I work at a hospital. I'm on my feet all day. I interact with patients and staff and caregivers, and I make them feel better. I'm not a doctor. I'm not a nurse. I didn't go to medical school. My job is to make dances. I am a movement artist in residence at the Georgetown Lombardi Arts and Humanities program at MedStar Georgetown University Hospital in Washington, D.C. What exactly does that mean? As an artist in residence, it's my job to see the hospital as more than the sum of its parts. I use movement to foster a culture of creativity and community building as part of the hospital experience. Me and my 3 fellow movement artists lead dance encounters for patients and providers right on site. We use dance to transform a space sterile and void of personality to one pulsing with possibility. Every October, the Arts and Humanities program has our Day of Dance. On this annual day, a small cast of dancers weaves itself through the hospital units and lobbies and hallways. We are a movement choir. For the past 3 years, I have directed and choreographed the Day of Dance. Today, I'd like to tell you what it's like. Our dance begins in the hospital's cancer wing. In the main atrium, our resident musician, Anthony, begins playing his violin, and the dancers enter one at a time, striking a shape like a statue. Across the atrium, a middle-aged gentleman, previously slouched in his lobby seat, perks up to see what's happening. As the music swells, the dancers move in unison, incorporating gestures that represent the breadth of circumstances of a hospital visit, woven in with graceful and lively sequences. Anthony's soft violin sounds are drifting up to the offices on the 2nd floor. We encounter a group of medical students and catch them by surprise on their usual route through the atrium. After the opening sequence, the group moves like molasses in a slow motion processional down the main artery of the hospital, hugging the wall to one side and dancing with just our arms on the other. We smile and say hello to the bewildered janitors and administrators as we slowly amble past. We pause and gesture to allow an elderly woman pushing a companion down the narrow hallway. A line of people has started to build behind us, mimicking our movements with curiosity and delight. They look like they've almost surprised themselves. One of our followers, way back in the line, is Dr. Nick. Dr. Nick is an orthopedic resident. He's been sent by his supervisor to represent the whole orthopedics department in our dance today. Dr. Nick has no formal dance experience. But today, dance is not about training or performance or perfection. Today, dance is just about saying yes. We make our way outside and engage in a series of solos and duets on a patio. It's a high foot traffic area right outside the main entrance of the hospital. Dr. Nick is fully invested now. His inhibitions are starting to fade with the contagious effect of our dance and music, even as visitors and staff, his colleagues, pause to watch. We make our way back inside and up to the chemotherapy unit. The staff know we're on the way, and they've given us enthusiastic permission to enter. They've also given the patients the opportunity to open the curtains and participate and witness in our dance, or to take hold of a rare moment of agency and close the curtains and opt out of this experience. We share short, intimate dances with the patients we see in the unit, those who are awake anyway. Leading up to our day of dance, we had published a map with our route and stopping points and shared it with the whole hospital network. So as we make our way into a sprawling intersection where the hospital's 4 main buildings intersect, some staff have wandered out of their units to see us pass by. Some jump in right away with abandon, surprising their colleagues. Others watch skeptically, unsure what to make of the dancers in bright shirts and their violinist overtaking the usually bland fluorescent hallway. I spot a stretcher coming down the hallway. I gesture our universal sign for pause, and we glue ourselves immediately to the walls to make space for the people to pass. We offer the transport team and the half-conscious patient some encouraging gestures as they pass by. Next, we scatter through a waiting area where people are awaiting news of their loved ones in surgery. We look them in the eyes. We take in their fatigue, their fear, their sorrow, and we dance for them. We head upstairs to the pediatric unit, where a group of young patients has been gathered into the playroom to watch us. They sing and dance and clap along. As we exit, a mom stops one of our dancers and thanks her for a moment of grace in an otherwise endless year in pediatrics with her child. In her eyes, there is a look of conflicted joy, relief for indulgence in a moment of beauty, even when her child was in pain. We encounter a security guard, a familiar face I've come to know in my years there. He smiles broadly and encourages visitors to make way for our passing parade. A few minutes later, the resident robot rolls past, its mechanical beeps and pivots, now a proud solo in our chorus. Such a diva. Our dance has made its way back to the atrium, where a group of staff on their lunch break are waiting for us, along with some unsuspecting visitors. We enter and invite everyone to close out our dance with us. Most do, while others make their way to the edges to watch, but they stay, and they're captivated. My fellow movement artists lead everyone through some stretching, some breathing, and we shake it all off in a grand finale of sorts. In that moment, it doesn't matter why any of us are inside the hospital that day. It doesn't matter if you're a head surgeon, a patient, a kitchen hand. What matters is that in that moment, we are alive and we are together. You might be thinking, doesn't all of this get in the way? The answer is yes. And that's kind of the point. Every element of our event, the choreographers, the collaborators, the timing, the route, has been meticulously designed to disrupt just enough. With my innate understanding of that hospital's corners and crevices and ebbs and flows, we were able to build something that was equally playful and practical, with safety remaining our number one priority. We didn't just dance in the hospital. We danced with the hospital. Our day of dance challenges the idea of what a healthcare space could be. Even for just a moment, we create a culture that invites people to say yes to something expressive and personal. We give people a reason to look up and take a breath, see something beautiful. When we do that, we jangle the stagnant air. We shift the vibrations of the hospital and we change how it is experienced. When we interrupt that norm, we can begin to reimagine our healthcare spaces. Could a hospital not only be a place that promotes science and innovation in medicine to heal and save lives, but also foster creativity and community building as part of that? The impact of our day of dance reverberates through the whole Georgetown community. We hear from returning patients and staff year-round about the resonant delight of encountering us on that one day a year. One staff member described it as like a prayer. A patient told us, "It made me grateful that I had to come in for treatment that day." Dr. Nick, who began his journey with us a little shy and uncertain, left us with bright eyes and a transformed perspective. He saw the hospital in a new light that day too. When we invite participants to tap into their self-expression, we empower their humanity. When that experience is facilitated with mutual respect and understanding, and within the realities of a living, breathing hospital, then that hospital can serve in a whole new way. It becomes a place that, beyond the poking and the prodding, is a place that celebrates possibility and reminds everyone what they are staying healthy for. When we begin to swim in those ideas, then we can ask, why just one day a year? Why just one dance? At the Arts and Humanities program, when we make space for dance, we also make space for stretch breaks for the staff in the units, yoga classes in the hallways, adaptive dance classes for patients with disabilities, arts integration as part of medical school curriculum, pop-up duets in the lobbies. Before long, a cultural shift begins to emerge, along with bountiful and thoughtful innovation between artists, medical thought leaders, and interdisciplinary experts. as the healthcare system evolves to meet the demands and circumstances of our time. When that happens, we all have more of a say in how we experience the healthcare system, no matter how or when or why we encounter it. That agency, above all, is a priceless gift of empowerment and access and compassion. And that is why we should be dancing with our doctors.